Are you an occupational health provider looking to grow your clinic, attract better fit employer clients, and get out of the discount network trap? This presentation introduces the Occmarket platform and NAOHP's new injury management and total worker health program, a turnkey, value-based model that helps you become a strategic partner to employers. You'll see exactly what's included in the new program, how national experts support your rollout, and how participating clinics are generating 5 times ROI by delivering integrated, high-impact services like injury triage, AI-driven prevention, wellness analytics, job demand analysis, and return to work planning. Learn more and explore at occmarket.co and join NAOHP and get listed as a preferred provider. The links for both the Occmarket and to join are below. Whether you're a seasoned OccMed provider or just starting to expand, this video will show you what's next and how to lead the change in occupational health. Good morning, good afternoon, everyone. Dr. Larry Earl here. How are you all doing today? This NAOHP presents, and today we're going to talk about Occmarket. But before we get started, the usual housekeeping stuff, I want to know that you can all see me and hear me okay. So give me a shout in the chat box that you can confirm, you can see and hear me, and you should see a slide on the screen. Thanks, Eugene. Eugene, hey, there should be a slide on the screen, Occmarket Unified Injury. So, okay, good. Thank you all for that feedback. Obviously chat is on the right, and there's a Q&A icon over there as well. If you'd like to ask questions, you can use either chat, Q&A, I don't care. If you want to come up on screen, raise your hand, and we'll have you come up here and ask questions. So today we're just very simple. We're going to present kind of the concept of Occmarket. What is it? Why did we come up with it? What's it all about? And we're going to walk through some of those concepts, and then we'll go to the actual platform so you can see how it works. So with that, let's see. Let me just check everyone's hello. Okay, good. So I'm going to jump over to my presentation screen, and let's get started. So Occmarket is a unified injury management, total worker health connection between our members, selected members, and our employer clients, both existing clients and new clients. And we call this a value-based product, value-based network, as opposed to the typical PPA or employer-based PPO type products. I'm going to talk about that a little bit. So the reason this came about, one of the reasons this came about, was we have many members that are large health systems, or even if you're not, sometimes you have out-of-state hires that need an exam and need some testing before they even get to your organization or pre-placement exam. And our members wanted not to just have them go to some random clinic that they didn't really know. They'd rather have them go to another NAOHP member. So could we bring all those together in one platform? That was one reason. And the next is, we all provide great service for our employer clients or existing clients. So they come to us and they say, hey, you're doing a great job for us here in Tallahassee. Can you help us in Phoenix or Dallas or Tampa or somewhere else? And so if you were a single clinic or you were a regional clinic, even if you're a health system in a particular metro area, no, you couldn't help, but now you can because you have other NAOHP members that are vetted, and you get to know that you can coordinate care for your client with the other NAOHP members. So that's kind of story number 2. And story number 3 is really having a marketplace of our own members that we feel as NAOHP members that we are more attuned to the needs of the employer than the typical Joe Blow urgent care center down the street. That, we can take care of some injuries and we'll do some drug screens, but that's really the extent of our employer engagement, right? Our members tend to be very engaged with their employer clients and want to give that higher level of service and accommodation. So we want to identify those clinics for the outside employer marketplace and be able to come to us and know that this is a place that's going to serve their needs better and have better outcomes for them than just going with some PPO discount. And that's all their claim to fame is. Okay, so value, not sticker price. So these are some of the employer pain points that we're trying to address. Always rising costs every year, no matter what. It seems healthcare costs go up. Productivity loss, of course. Average return to work for work comp injuries might be more than 15 days. We'd like to reduce that. Productivity losses, the indemnity costs, you may know, are 2 to 3 times the medical claims costs. So all of these sort of preferred networks that just discount PPO is just a discount to the provider. That's their whole reason for being. Well, that really only represents a third of the cost, sometimes less. So who does it really save money? Well, the insurance company. Disconnected systems. We still have silos. You got your group health issues over here. You got your workers' comp issues over here. They're not connected as they should be. So you've got those data gaps as well. Those two areas are not talking to each other. And we've already talked about the limited PPO networks and basically that they're just discounts. So here's just a few of the kind of differences between what the typical PPO discounted network is. They're just looking for low cost. We're looking for outcomes. We're looking for value. What can we actually give the company that reduces their costs and increases their productivity and has a healthier, more productive workforce? Pricing models can be severe cuts, at least 15%, if not much more than that, off of state fee schedules or other types of fee schedules, sometimes even Medicare fee schedules that have little to do with occupational health or workers' comp. So we're looking for other models, induce all of us to save money and have better productivity and healthier patients. The care pathways are not really, having protocols for a specific pathways of care are not specifically part of PPOs. Those are things that we would want to put into our injury management protocols, our return to work philosophies. And there's really no prevention per se for these types of networks. Whereas we will be integrating total worker health, industrial athlete types of processes with our network. And so those are some of the main differences. I'm just going to pause for a moment. I'm just going to jump back to the chat screen, make sure there's okay. We're good. So what we're looking to do with members who are coming into the Occmarket is becoming an advisor to their employer clients. You're not just a commoditized delivery of commoditized service, right? A place where they just send people to get drug screens and injury care, but an advisor that helps them with their workforce health trends, that you can integrate wellness, things that are happening on the group health side and on the ergonomic side, on the safety side. So all the total worker health types of concepts from NAOHP that they've been trying to do for 20 years now. This is a place where we can bring that together. And you're an accountable partner in terms of looking at metrics to benchmark yourself against and the company against you're working towards together. So again, not just counting up how many procedures did you do, how many drug tests did you do, how many injuries did you see, but what were the outcomes of all of this? They help to reduce absenteeism and disability and loss claims and all of that. And we've got a lot of folks that are coming into the Occmarket to help us do these things. And not that everybody would have to do all of these things, but there are some pretty sharp people out there that are coming in and helping us with things like injury management programs, Michael Stack, total worker health, wellness, programs with Shauna Dunbar, Stuart Levy, um, job demand analyses, transitional duty types of platforms, uh, care space coming in with AI motion detection and bringing that very cool technology into how we look at people's job abilities. Let's say, looking at these AI movement patterns, pick up things that you just can't see and you can't know until the injury happens. Well, here's a way to identify those and help people with flexibility and strength so they don't get those injuries. It's very interesting stuff. Um, and then, helping with billing and pre-authorizations and referral management, things like that, that kind of get lost in the weeds sometimes. Ortho referrals, PT referrals, getting delays on all that kind of stuff. So we have partners that want to help us speed those things up so we can all get those things done faster, get people back to work faster, get paid faster. So that's all part of the AUK market. Technology is, as I mentioned, it is kind of fits in lots of different areas, movement analysis, billing, authorizations, data, the metrics following all that is all technology driven and given to the employer via portal. And there's lots of ways that we might put this all together. You might just have a listing on the Occmarket and that's all you need. And that's fine. That's all it is, part of your membership. But there's all these programs that we can meet with you and put together and start building that consultative part of your practice with employers, new employers, or your existing employers. And so the fees for that could range all over the place. This is just an illustration of a $4,500 a month program that would involve many of these things. I'm not going to go into all of that now. We don't have time, but we would do this on a one-on-one basis with you and decide, well, which areas do you want to start moving into? Where are you in your whole evolution of your practice? You're just starting out, maybe not all these things, but we want to progress as we get into these and again, become that more consultative partner with your employer clients. So there would be a plan for that, an implementation roadmap. Again, I'm not going to go into all these details, but we would if we sit down and meet with you. And these are the kinds of things that you would now be bringing to your employer. Again, not just commoditized services, but bringing them a plan. You've assessed their claims data, their OSHA logs. You've looked at all of that. You've looked at their corporate health profile, perhaps, and you've got their claims data on the group health side, and you know that their rates of obesity and diabetes and musculoskeletal disabilities that they have inherent in their population might be affecting how many injuries they have, the recovery time from those injuries. It's all interrelated, but right now it's silent. So we're bringing that together. That's part of what you will be doing. So you've got that whole total worker health sort of roadmap that you'll be navigating with those employers. Prevention is part of this now, using AI tools and other wellness tools to prevent some of these injuries, giving them a dashboard that kind of brings all of this stuff together, looking for specific metrics on what you're going to save them year after year. So those are the kinds of things that we want to bring to the employers. And we'll go through this with each of you individually. Again, I'm not going to go into great detail on this, but each different program would have an expected outcome. We do an analysis. We figure out what are the right programs for this particular company that you're going to help administer. Some of these things you'll do on your own. Some of these things we'll bring in partners for. And each one of them will have a predicted cost and a predicted savings benefit. And they're all going to have an ROI, right? Otherwise, why would we do that? So there's an ROI for the employer, and there's obviously going to be an ROI for the member, right? Everything that we do has to have a return to you. So again, this is nothing specific. These are just sort of illustrative examples, and we would create this for every member that wants to come in and meet with us and decide which partners to work with. And then we'll figure out a plan and what would this be predicted to make you every month by coming into these kinds of programs. So I think that's mostly what I wanted to talk about. So again, we're looking to do this as either a platform where you can just list your center and provide services. They'll still just call you or email you, or we'll integrate it all together. And we're going to show you in a moment what the Synchromedics part of that is in just a moment. But everything that we would do in a total worker health or injury management program in those combined programs would be designed to obviously make you more profitable and increase your business and make you a stronger partner for your employer clients. So, yeah, so I think I'll leave it there on this part. Again, the rest of this is something that we would go in with you on a one-by-one basis. I have a link in the chat there if you want to go ahead and set up a call with me. It's up at the top of the chat area. So please go ahead and set that up anytime you like. And what I'm going to do right now is, if there are questions, fine, I'll take a look. Otherwise, we will go over and show you the actual Occmarket platform and how that all works. So let's see. Cooper and team, I'm going to let you take that away.
All right. Thanks, Larry. And yeah, this is great information. And this is the Occmarket is going to be, I think an industry changing solution for occupational health and wellness. There's so many opportunities here, and it's just really untapped. I mean, everyone's seen marketplaces, but we have not seen a marketplace yet that's designed, as Larry stated, for occupational health professionals that provides that national network of trusted experience. So Nazmul is my project manager. He's gonna get this demo started here, and we'll get you guys some high level information on the marketplace, how it works. And again, stop me anytime if you have questions. Like Larry said, raise your hand, send me a comment here in the chat, and then I'll answer it and stop what I'm doing.
Yeah, I think in this, sir, you can start working on the demo. If there is any question come up, then we'll take it. Thank you.
Thank you. All right. Thank you, Larry and Cooper. Let me share the system. Let me know if you can see my screen.
Don't have it yet.
Is it visible?
Not yet. Okay,
No.
now we have your screen. Here you go. Yeah, we got it.
Yeah. Sorry about that. So my screen is visible. This is our website. This is our system. From here, businesses can sign up or clinics can sign up. They can manage their appointments. They can schedule their appointments. They can provide their services. They can get their results, authorizations, etc. So when you come to the system, you can go to browse clinics. From here, you'll be able to see a vast majority of clinics. Here, you can filter the clinics. You can filter by services. You can sort them. So let me search for a clinic.
So, sir, before diving into the system, I think we should give our users a brief overview of how the system actually works. So the NAOHP Occmarket is basically designed for both the employer or the business and also for the clinic. So the idea is a clinic can actually enlist on the NAOHP Occmarket, and businesses can actually order services directly from the NAOHP Occmarket. So this is the basic idea. So the system actually facilitates this order servicing, payment, and then managing your appointments and everything. So as a business, you can log into the system or sign up into the system as a business or as a clinic. So when you log into the system will allow you to actually schedule appointment to any clinic that is enlisted in the system. And then the clinic can actually accept and then provide you the services. So when the clinic provides the services, then they get automatically paid to this payment system that is already integrated into the system. So that is the basic idea. So what now Sir will demo is how the whole system actually works. If there is any question, please feel free to chat. in the chat box. Yeah, Indra, go ahead.
Okay, thank you for that. So let me log in as a user first, so I can show you how the system works. I'll log in as a user. After you log in, you'll see this screen. You'll see your businesses. You can have multiple businesses here. If you own a clinic or if you claim a clinic, we'll show that process later. You'll see the My Clinics option and you'll be able to see all your clinics there. If you are an admin user, you'll be able to see the admin option. So anyways, as a business, let me show you how you can approach the system. So right now I'm on the Browse Clinic page. I need to book services for my employees or patients. So I'll come here, I'll look for the clinics that are available in my area, or I can search for a clinic. Let's search for a specific clinic. I'll click on the clinic. I'll be able to see all the clinic details from here. On the right side, I have an option to schedule appointment. And if I scroll down, I'll be able to see all the services this clinic provides, details about this clinic, any reviews, the contact information, or the direction to that clinic if I want to physically go there right now or check. So let me book an appointment to show you the process. From here, from right side, you can book an appointment. You can select as many services as you want. Select an appointment date, appointment time, and the business. As I showed you before, you can have multiple businesses. So from here, you can choose which business, under which business you're booking this appointment for. When you click on schedule appointment, you'll be asked to provide the patient information here. Let me provide the information. And after you provide the patient information, you'll be asked to provide the authorization details. You can add some comments here. And when you click on submit, this will take you to the payments page. So as a business, when you book an appointment, you select the patients, you provide the authorization details, and you click on submit. This will take you to a payments page. From there, you can make the payment, and this payment will be held in Occmarket system as an escrow. Occmarket will act as an escrow, and when the clinic provides that service, after that, the business can confirm that they have received that service, and only then they will get the payment. So let me just input these details.
Yeah, let me make one point here, guys. So one of the big things here is that you've got a national network. You've got the ability to find the service anywhere in the country with an NAOHP member. You're able to, that member is vetted by NAOHP, so they're quality. And then when they schedule the service, that money then is ready for processing. So if your team is doing, traditional workflow in Occ Health and they're resulting, same day for these services, then there is a processing time with Stripe, like it's a few business days. But as you start using the Occmarket, you'll start seeing deposits every day. Instead of, waiting for, like, let's say a traditional TPA based system where you have to wait every month or 2 months or whatever it is to get, one reimbursement for a group of services that you provided last month, you're now getting paid daily. So big difference here.
If you're finding this helpful, go ahead and click subscribe and hit the bell icon so you never miss an update from NAOHP. We'll keep you in the loop on the latest Occmarket features, value-based care tools, and everything happening in the world of occupational health.
All right, I'm going to continue. When you click on pay, this will get the payment through Stripe, and it will take you back to the system. payment is successful. You can go to your appointments. So right now I'm back on my business page. When I click on manage business, it will take me to this business's dashboard. I'll be able to see all the appointments that I've booked for this business. I'll be able to see all the payments I have made in this business. Then there is an option to add more users to this business. So you can have multiple users, HRs or admins for managing this business. Then you have the settings page for your business details. So I booked this appointment right now. And as you can see, this appointment is currently on pending status. What that is we have booked that appointment, but we still don't know if the clinic can provide the services at this time or at this scheduled date. So let me jump back to the clinic side and show you how things are working from here. So in this user, I have both access to this clinic and this business. I have done this to demonstrate to you how the system is working. So let me go to the clinic and go to the dashboard of the clinic. So I booked the appointment for this particular clinic. And as you can see, you can have as many clinics as you want. You can manage all the clinics from here. You can see all their locations, all the branches that are available for that clinic, and etc. So let me go to the clinic dashboard. And as you can see, similar to business dashboard, in clinic dashboard, you also have the appointments. And by the way, you can see the appointment in list view or in calendar view, in week, month, or day, as you want. So anyway, from here, you can see that this business booked an appointment at this time, asking for these services, and currently this payment is being held. As I said before, the escrow is implemented here. So NAOHP is currently holding this payment. So as a clinic, when I view this appointment, I'll get some additional options. I'll get the option to confirm this appointment. When I click on confirm, business will be notified that your appointment is confirmed. You can come in for the services. I'll click on confirm appointment. The appointment is successfully confirmed. Now business will be able to send their employees or patients to this clinic. And after this patients arrive to the clinic, they will provide their services, and after that they can use our system to update the status of that appointment. So as a business, when you send in multiple employees to different clinics, it's very hard for you to keep track of which employees I sent, what's the update of their appointment status, what are the updates of their results. So in NAOHP, in Occmarket, you can manage and see all this information in one page. So at the clinic, let's say the employees have arrived and I have provided them the services. I'll go to this appointment, I'll click on the appointment, and I can choose to complete this appointment. If I scroll down, I will see all the authorization details. I'll be able to see all the patient details from here, and I can choose to add the results directly from here. Let's say the results for this user. I can even add an attachment. When I click on submit, the result has been sent to that business for this patient. And then I can mark this appointment as completed. So when I mark this appointment as completed, the businesses will get an option to release that payment. So as a clinic, patients came to my clinic. I have provided them the services. I have provided them the results. I have completed the appointment. Now I want to get paid. So after I have marked it as completed, businesses are notified that the services are provided. Please release the payment. So when I go to my platform as a business, I can click on that appointment, check that appointment, and then I can confirm that the service is received. After I click on this, the payment will get released to that clinic. It will ask for the confirmation. When you click on that, confirm, the payment is sent to the clinic. So let me jump back to the clinic page. And here you can see the payment is paid. It's received. So if I go to my payouts page, I'll be able to see that the amount is received here. And if I go to my Stripe profile, I'll be able to see my recent earnings. So from my Stripe Express account, I can directly get the money to my bank. Let me go back to my system. Okay, so that was the part of booking appointments. And now let me give you a brief overview of how the clinics work. Apart
Hang
from
on,
platforms.
there was a question about the appointments. Can that be turned off for folks that want to use just their EHR for scheduling? What would be the process?
Yeah, that's a good question. I was just reading some of these as well. So yeah, we
Yeah.
can talk about that and customize the solution depending on what your needs are. So there's a lot of questions here, which is great. Love the feedback. I'm trying to answer some of them right now. One of the big things that I'll comment on is, and it's huge for this, right? This is all about quality, and when it comes down to it, you set your own prices as a clinic group, right? So the difference here versus a traditional TPA is these large TPAs generally, undercut clinics and hospital systems because they're passively providing volume to you, which is great. But this is slightly different in that you set your fee schedule in the Occmarket. When others find you, they pay that fee and the service charge related to it. And instead of taking then, for example, let's say $50 for a physical, you can now charge your $110, which is your normal rate, and shave off a percentage as a processing fee for the Occmarket. So now you're generally going to be generating quite a bit more revenue. We're estimating about 30-40% more revenue than using a traditional TPA platform. What other good questions do we have here while we're pausing for a minute?
Yeah. I think you got most of the rest of them. I was just looking through myself. I think we covered them. If not, if we missed something, just pop it back in if you would at the bottom. I think we got them all.
Yep. All right, guys, you can keep going.
Yep. Thanks.
All right. So let me explain the clinic part of it. We explain the business part of it, how they can approach the appointment process. Now let me show you the clinic part of it. When you're a clinic, you'll be able to see all your clinics. If you don't have your clinics listed in your account, then you can go and claim your clinic. So I will show you that process too. I will give you a brief example on our live system. So let's say currently all the clinics in our system is already claimed. So there is the process of claiming the clinics. When you claim a clinic, it will show up in here, and then you'll be able to get the option to manage the clinic. So let's say you have claimed the clinic, you got the access to manage the clinic. When you click on manage clinic, you'll be taken to the clinic dashboard. And as I've shown you before, the bookings process, there are more features here. For example, locations. Your clinic can have many branches. So from here, you can add the location of your branches and they will show up in different filtering criteria. So you can have one location in Minnesota and let's say another location in New York. And those will be separated, but you'll be able to manage both of them from this dashboard. Next, you have the services. And as Cooper mentioned, you'll be able to fix your own price from here. We have the services in our system. And from here, you can choose which services your clinic provides and the amount you want for that service. You can configure it by yourself. You can click on Save Changes and those services and with those amount will be available for your clinic. Then we have shown you the payouts page. Then we have an option about open hours. So what this is basically when I was booking the appointments, let me jump back for a moment. When I was booking the appointment, you saw the appointment time here. So let's say I pick Wednesday and I got this time. These are the appointment slots that clinic provides, that clinic is active on. So for example, this clinic is not active on Saturday. When I go on Saturday, you'll see that no slot is available for the selected day. Let me go back and show you what I mean. In open hours, you can configure your clinic's starting time and ending time. You can have multiple segmented time. For example, you're operating from 8 a.m. to 3 p.m. Then you're taking a brief break and starting from 6 p.m. to 11 p.m., for example. You can configure them from here and you can configure and if you leave them empty, those days will be considered as your clinic's off day. When you configure them, the appointment restrictions will be placed for the businesses. And then you have the users option. So one clinic can be managed by many users. Many users can manage many clinics at a time. So we have provided the users that kind of freedoms from here. And then we have the settings page. From here, you can provide your clinic's details. You can customize the about screen page. You can select all the services your clinic provides, all the features your clinic provides. You can provide your clinic's website, phone number, email, and this email will be used to send you the notifications. That's about it for the clinic side. Cooper, do you have any questions about clinic?
No, I don't have anything right now. I was just replying to some comments here, some really good ones.
Yep.
One big one is what happens if a company doesn't pay? Are they auto generated reminders? And so on. So at the end of the day, this is again different platforms. So when those employers are scheduling services, they have the option to pay via Stripe with credit card or ACH. We can always talk about other methods of payment later, but at day one, this is what we want: upfront payments for services. And then as far as notification goes, there is an email option for notifications. So those can get pushed to the clinics or the businesses.
All right.
Thanks for that question, Nancy.
Do you have any other question or should I continue?
You can continue.
Let's see, there's one that just came up here. What about intake paperwork? Oh yeah, that's a good one. So the authorization for services.
Yeah, so good question. So when you
Yeah.
authorize a service, we went over that, and we can discuss it again. But at a high level, when you schedule that appointment, you're going to put in the employee information, and then once that's entered, the next pop up is going to be for the service authorization. Choose what services, which agency, FMCSA, etc. If it's an observed test or not, those types of options are in there as well. So you're going to be able to get that authorization, and you're going to be able to see the authorization so you know what your clinic team needs to do.
All right. When you click on view appointment, let me go over that again. So when you click on view appointment, you are seeing the authorization information here. So when you're creating an appointment, you are asked to provide your patient information and authorization information. Those will be available in the appointment details. So now let me show you the other features we have in the system. So in your accounts page, it's default. You can customize your information. You can update your password. And here you can choose to get the notifications that you want. So currently we have the email notification of appointment updates and the result updates notification. In future, maybe we can add more notifications. And then let me show you the admin panel, how the admin will see the system. When I go to the admin panel, so this user is basically having all accesses for business, clinic, and admin. I've created this user especially to show you the demonstration. As I said before, as a clinic, you can make a request to the make a request to the system that you are an owner of the clinic. If the clinic exists in our system and you currently don't own the clinic, or you don't have access to the clinic. So when you put in the requests, those will appear here, and then users can, the admin users can authorize those requests and approve the request so you can get the access to the system. Then we have the services configuration. From here, we can choose to add new services as you demand. You can see the admin users. And then what we have here is a clinics management page. So from here, we can, if you are a new clinic, you can provide us the data. We will upload the data from here. We will register your clinic from our system. And as you can see, as an admin, we don't have access to your clinic's data. We just have the overview of your clinic's information. Admin can see if you have connected with Stripe. They can give you the badges, but they don't have access to your internal clinic's information or internal business information to provide you the security. That's about it for our systems. Any last questions?
Yeah, I just answered a few questions here, some good ones as well. So if so, think of the Occmarket as this national network and the starting of what we're calling it, customized Occ Health ecosystem. So if you're a small clinic and you just want limited functionality, you want services to be pushed to you, from all over the country, kind of passively, then great, you have a free listing and it's always out there for you, right? If you want to grow, if you have a growing clinic or you've got a large institution and you want to be able to have more functionality, you want HIPAA compliant web forms for patients to fill out, like respiratory questionnaires, audiogram questionnaires, work comp history, etc. Then you would upgrade to Synchromedics as its full version. And we do have other packages which we're updating right now as we speak. So they'll be affordable, they'll be easy to launch, and then you'll be able to add connectivity to different things like Uber, Lyft for patient transport, forms, as I mentioned, drug screen capability through like chain of custody with LabCorp. There's all kinds of stuff coming right now with our API library. and internal marketplace with Synchromedics. So this is like step one. This is establishing a network. And it doesn't have all the bells and whistles yet, but it's very functional. It works well. And that's what we're doing is we're trying to explain the big picture, how this system is going to work for your practice and the big key benefits to using this platform over a traditional kind of TPA based system. Yeah, Kelly, good question. Is this live now? It is live. We're in beta right now. We're finishing with some local clients that we've got loaded in our platform. We got about a dozen. So we should be done with this pretty soon. Larry, when you have a go live for the remainder of the members?
No, we're working with members individually on bringing on like one right now that we're waiting to bring on for their in-house out-of-state hires. Like I mentioned, one of the first things that we're doing, health system that wants to use it for their out-of-state hires. So we have to get enough out-of-state members on there so that it makes sense for them. And we're getting close to that now. So we'll work individually with you to see what your use cases are. Maybe it's starting a total worker health program with one of your clients, and that data will come in here as well and generate the dashboards for them in their portal, in their employer access points. So
Yeah.
yeah,
Oh,
so
sorry
we're
about that. Sorry.
yeah, we're ready to work with you individually to make sure that it's set up for these sort of more intensive relationships with your clients, so we can really connect you. Again, it's not just transactional. It's it's getting into the consultative partnerships with them. So we'll
Yeah, Kelly. Sorry about that, Larry. Kelly, to answer your question, I think you're also looking to know, can you get a listing now? Yes. That's a short answer to that. So anyone that wants a listing, just get a hold of Larry and we'll get you manually processed and set up within the platform. And it's a free listing. So
yeah. Great.
yeah, I have my tarot cards here in front of me. So I figured that's what you were. Any other questions?
That's great. Appreciate the questions. Been a long time coming. I know we've been talking about this for a couple of years now. So now we're finally live, and now we'll be rolling out over these next few months and starting to bring employers on. So very exciting stuff. Okay, I don't see anything else. Go ahead.
The last thing I'll say, sorry, Larry, one more time. The last thing I'll say is that, yes, this website and this marketplace is live. So it is out there. If you search, Occmarket, what is it, Larry? What's the URL?
Occmarket.co.
.co. There you go.
Yeah.
You'll find it and you can play with it. And you can see how it all works. And like I said, Larry can get you in there pretty quickly and set up and established, and you can put your clinic information and settings and fee schedule and everything. And it's out there. So the world can use it.
Yep. And then, like I said, if you meet with me, we'll start to talk about these other programs that you can start bringing in. Again, get to that higher level that we've been talking about for years now of relationship building with your clients. So that's all part of this concept. All right. So thanks everyone for staying with us. We appreciate it. Appreciate your attention. And you have my link at the very top of this for meeting with me. You can always email me as well. You get emails from me almost every day. And for any of your colleagues that wanted to see this and missed it, we will get that link out, the video. We'll get it posted later today. So thanks again. And yeah, that'll do it.
All right. Thank you, everyone.
Bye now.
Everyone.